So when you have a case that that you feel would need the air assist, if you do a rectal and you don't feel a lot of anal tone, they may have had hemorrhoid surgery. You may have a patient who has COPD, diabetes, an older population where you just anticipate that you're going to have a lot of air release. You can just put some gel inside of the air assist, slide it onto the colonoscope to have it ready. Either leave it close to where as you slide the colonoscope in the patient, you can just leave it there by the anus, and you can interface it with the anus as you need it. If you have a tight segment of diverticulosis that you need to expand and find that little shadow, so you can go in safely. And you can also just slide it up to the hub and use it when you're actually withdrawing. So pass it off like a baton to your tech if they need to hold it while you're either, if you need to insert an accessory. You're going to find that you're going to be able to maneuver this without assistance. It's almost like when you started doing your fellowship or your residency and they gave you the colonoscope and you're like, there's two dials and you have one hand and you're like, how am I going to be able to, manipulate these dials and with dexterity? It's the same thing with this. There's going to be a little bit of a learning curve. Now I basically will insert the scope all the way to the cecum. If I find again that, I do a rectal, I find that there's going to be a lot of like anal tone laxity, I'll just put an air assist on there. If I insert the scope and all of a sudden I have a lot of air release, air coming back at me, I'll just put one on then because I know at some point I'll probably use it in the sigmoid. So once you get to the cecum, at that point, I usually just slide the air assist down towards the anus so it's ready. And as you come out, and everybody has, their ways of removing the scope. Some people are way, far away from the anus. I like to be closer. So if you have the assist right at the anus and you encounter a segment of colon collapse, or if you're looking for like a lower GI bleed in an area where there's a lot of diverticulosis and you need to pounce on a GI on one of these things before they just completely disappear, you can just slowly just cinch it down with your thumb as you come out. It's like a little squeezing technique. You just kind of, and it gives you complete control. If you need to go back in, and you just slide the scope through, this will not enter the body. It would be very rare if this actually, especially with our new iteration, we have less of a pronounced angle. So it's more flat like a flying saucer. And I've put this thing, I've actually pressed this against the anus under a lot of force and it hadn't gone in. And if it does, we have it angled so where you just pull it right out. Obviously, if it goes in, it should come right out easily. So you're coming out, you see an area that's concerning, that you need to have a little more colon expansion, colon inflation. Again, just slide it down. If you see a polyp that you need to get to and you like to kind of release your hands and you want to do the accessories, have your tech just hold it. It's as easy as that. Make sure they don't squeeze too tight, especially if you need to manipulate a little bit. It'll get a little bit annoying, but certainly less annoying than if they're putting buttock pressure, which almost always impinges the scope and, of course, doesn't work effectively. Some of the use cases that you can anticipate just putting this on if you don't want to use it every time. I mean, we're going to find that our price point, it should be a negligible factor because of the value that you're going to get from the assist. It's going to help you find more polyps. We're doing our first pilot study, and we have a patient population, patient volume of about 40 patients right now. And we're finding that it is enhancing the adenoma detection rate. So we're preparing an IRB study now so we can present this at the national conferences. So you're going to find that just with regular screening colonoscopies, it's going to allow you to see around folds better. Sometimes you'll go into the colon and when you come out, all of a sudden a polyp magically pops up and you're like, how did I not see that when I was going in? These will help you see those right off the bat on insertion. When you use GI Genius, I know that's like a sexy thing now, all this AI. Without good colon expansion, it has less value. So with the Air Assist, it'll be able to, express those folds better. And so theoretically, the GI Genius should work better. We haven't really done a head-to-head with GI Genius. We think it'll be like a good accompaniment for it,
Mhm.
a good addition. And also, if you're using, some people use EndoCuff. I personally don't love it, but you can just use it as an adjuvant to any one of those, other things that you use. When you are looking again for GI bleeding, lower GI bleeding, you tend to have patients that have very lax sphincters. I don't know what the deal is with that. I always find that I get air release when I do the lower GI bleeding. I mostly am a GI hospitalist, so it's one of the things that I see frequently, and I wish I could have had this on other occasions throughout the years because I've been using this and it really provides beautiful visualization. And again, have your tech involved. You'll find that either you're going to just be able to manipulate this by yourself. If you are in a segment where you want to fine tune it, you see a polyp, you haven't moved, you're in the same vicinity, just push it down. You can actually put pressure on it. You can turn, you can get your accessory inside. Even when you expand the colon, you generally have a few seconds where you can slide the accessory without even any colon collapse. This may even still be interfaced with the anus as you take your hand away, as just pushing the scope in. And then once you have your accessory in, you can just fine tune it and then just have them open the snare as you need it, and just like you would do a standard polypectomy. Now, with the use of cold snare polypectomies, it's more important than ever to make sure that your margins are clear because if you don't, there's no reason to even do the polypectomy. And I find that I'm sure that we're not getting around these polyps like we should. They always emphasize that we need real clear borders, and the assist is providing so much better visualization when now that we're snaring more polyps with cold fashion. If you're doing colon stents, a lot of times the prep isn't going to be great. You're going to have a lot of air release because these lesions will be on the left side. This adds so much better colon distension where you can see that little opening where you need to get your wire in and you need to slide your stent in. It just takes away the frustration and it should save time. I mean, I find that if you're not going to be fiddling around with trying to just distend the colon and you're getting all this collapse, it just takes forever sometimes to find the polyp again, to expand the colon. I find that if you're in a situation where you didn't put it on and say you're coming out and you're at 40 centimeters, you know that you're going to be able to get up to 40 centimeters quickly. So do a little suction polyp, get your measurement at the anus, even take a biopsy forceps and just, nibble. And then you'll see that, where the little cherry red thing, mark that you made, take it out, throw it on, 5 seconds, you're back up to where you were. And then you can proceed to perform the procedure in whatever standard fashion you do. Radiation proctitis, a lot of times you'll get, people get radiation, they get sphincter problems from that. You're working very distal and, you're going to have problems with air escape there. Potentially EMRs, big polyps in the sigmoid, big pedunculated floppy polyps where, it's in a curved segment and you just can't get the colon distended. You don't know if you're doubling up on the stalk. You don't know if you're getting enough of a margin from the little, from the polyp area. This is a great tool to use for that.
What scope sizes can you use for this? Does it
You
have
can
to be
use
a
pediatric
regular?
colonoscope
You
and a
can,
standard
it
adult.
still works on with a PD scope.
Yeah, I used the PD on because I needed that flexibility for that anal bleed, and I didn't have any air release.
So you can
And
use either, you can use any scope essentially.
you can use well, as far as the EGD scope, our gasket is 11 millimeters, so the PD colon is 11.8. So I know it works for PD colon. I don't, we don't have it.
But you can use your
Um,
regular scope. It doesn't
it
get
doesn't get
hard
too
or anything.
sticky. No, and matter of fact, that's why I redesigned this. I started to get some feedback. There, people were like, "Well, it's a little bit sticky," and we responded immediately. Within a month, we retooled this, and we made the gasket 2 more millimeters wider in diameter. If you get a little bit of and sometimes the ratcheting is good. You don't want too sticky, but sometimes the little bit of sticky is very good because it
Yeah.
just stays in place and you can actually push the scope in and it stays against the anus. Um, but you'll find that if you ever need a little more lube, just squeeze it down and the lube that's in there will you just need a smidgen and then you'll find
Yeah.
that it'll slide beautifully.
And what's it made out of? Is there
It's
any
made out of
latex?
surgical grade silicone.
Okay, so no
So it's
latex.
not latex. That's a great question
Okay.
for allergies.
And I guess the big worry about this would always be, is it going to increase the perforation rate? Not from the scope itself, but from over distension. So, and I
Well,
know I know, we have to use our, I'll know if the colon where I am is over distended, but
yeah. It's a good question. You'll use your standard practice with like just, how you feel the belly, you're sucking out the air. What I find is that I use less air because I find that I retrograde fill more when I'm just trying to inflate the colon. Um, so when I'm trying to see a polyp, I find that I ride the air so much longer without the assist. With the assist, you slide it down, you almost see immediate reaction. We haven't noticed any increased perforation rate. We're putting that down as one of our, obviously, our one of our um, uh, not indicator, but one of our endpoints or one of our,
yeah.
we're looking at that. We haven't found any increased complication rates. I've been using this regularly, no problem, no increased pain post-procedure. That has not been an issue at all. And again, you're just going to aspirate your air as you need it.
So are
And
you
this will
using
release
air or CO2?
CO2.
CO2. Okay, just making
Yeah,
sure.
but you can use, I think Dr. Quadri may be using air in his office, but most people now are using CO2.
Yeah.
And are
And I
you
guess
using
that might
CO2?
because before before using this, obviously I always use CO2, but unless I'm having significant difficulty in distending the colon, and then sometimes we have to switch to air just because
Switch to air.
but I'm hoping
You
that
may
this will
find that
keep us from having to do that.
you will definitely find that you will not need to switch to air when you use this. And the other thing is, your CO2 regulators have pressure sensors and they, that
Yeah.
to mitigate against overdistension. But thankfully, we haven't had any issues with perforation. And certainly
Good.
the FDA is watching us closely.
Yeah, I
Um,
bet.
yeah, so no, you'll find that you'll probably use less air.
How
Yeah.
many other people have tried using this so far?
So we have about 15 practices now that are testing it. There's another set of IP that has come out right after our patent that that slides inside of the anus. But they are so much more complicated. They require a balloon, lure locks.
Hmm.
They're going to be very expensive. This is so simple to use. And again, it doesn't need to go inside. You can actually get better visualization of the anus when I mean, if you're doing things that are delicate right around the anus, you can't have anything inside. And you
Yeah.
don't want to obscure your viz. The other thing is, remember, if you ever didn't want to hold this thing, just have your tech hold it
Yeah.
and you are good to go.